I'm going to try this. Please work. All right.
Hi, everyone. How are you? Just a couple quick updates today. Thanks for letting us take the day off yesterday, by the way, from the press conference, not from the work. We have 361 confirmed cases, and we have 12 fatalities of New Haven residents. Police department has 4 positive COVID-19 cases, and fire department remains at 7 positive total. The only other update I have before I pass along to Director Bond is just to underscore that given the holiday that's coming up, it's so critical that people, particularly at this time, practice social distancing and do not interact with others. Because we're experiencing the spike, people do not want to get sick now and do not want to get other people sick, because the hospital in 2 weeks' time is likely to start to really struggle to manage our health resources overall. If people are not careful and if we don't practice social distancing. So I want to encourage people as the holiday approaches to make sure that they continue to practice social distancing. And we've also gotten some complaints about nail salons and barbershops being open. We encourage people to report that so that we can have the police department and others reach out if necessary to talk with those businesses to make sure that they're abiding by the governor's and my orders around closures. Director Bond, can I hand it over to you and you can talk about spread the facts?
Absolutely. Thank you, Mayor. So one of the things that we're doing here at the City of New Haven is we've officially launched a public health campaign called Spread the Facts, Not the Virus. And we are trying to increase our communication and awareness to our community, both in English and Spanish. We have a couple of platforms that are going to be providing that campaign. Number one, we have a hub portal right on newhavenct.gov website, also bilingual, that has lots of information for the community and resources. We also want individuals to be aware of the cases and what our city looks like, and so that's also available online. And we also want to be able to streamline our communication. So not only do we have our hotline that's activated at 203-946-4949 for COVID-19 symptoms and concerns related to health, we also activated our Seek Fix app, where people can also report any needs of neighbor support, any COVID-19 concerns, and also any report of public gatherings that individuals want to inform of us. And also, if you have any businesses such as what the mayor just mentioned, instead of sending an email, you can now report it, take a picture, and put it right on Fix app, and we'll be able to ensure that we follow up with that. So I'm really happy that we've been able to launch that. Also, there's billboards throughout the city that you'll be able to see both in English and Spanish, that we can ensure that we're spreading the facts and the virus.
Any questions? I see that Tom Breen raised his hand.
Thank you, Mayor. Are any of those billboards currently up that Director Bond just referenced? Do you
Yes,
see
they're already up.
Where are some?
One is on Route 34. The second one is, where's the second gate? Don't quote me on the second one. I just saw the one on Route 34. Oh, the second one is here by Worcester Square.
Oh, great.
Yep.
Thank you. And Mayor, I wanted to ask about the city's contract with the Best Western in West Haven. Has that fallen through? Is there still a possibility that the Best Western will house New Haven homeless people who need a place to stay?
So just to be clear, it's the state contract. It's not the city's contract. The state is working all around the state to identify hotels to decompress the homeless shelters and basically move the homeless population into hotels. And they've been in negotiations with the Best Western and other hotels in the region. My understanding is that yesterday Best Western was off. Today Best Western is on. I'm reluctant to give any definitive answers until people actually are moved into the site. But the indications that we had this morning is that there may have been some progress on the Best Western site in West Haven.
Thank you. And do you have an update on how many homeless people the city and the state have moved into hotel rooms as of right now?
I'm sorry, I can confirm that. I know we talked about that. Or maybe I talked about that with Paul yesterday. But I can confirm the number. It's in the 800s.
Thank you. And then I'm happy to defer for a bit, but I want to get one more question in. I saw that the Partnership for Connecticut announced today that they'll be distributing 60,000 laptops to public school systems throughout the state. I don't know if you have a sense of how many of those might be coming to New Haven. And also, I didn't see anything in that announcement about how people who don't have internet access at home will be able to use the laptops for schoolwork. Do you have any answers to either of those questions?
Dr. Tracy, do you have a thought there?
So I may answer that, Mr. Breen. So I just was on a conference call this morning with the task force because I'm a part of the task force, one of the area superintendents on that. What we have is that every single high school student will have a laptop, and they're Dell laptops. As to the time of distribution, it is still being worked on right now as to when districts will start receiving those. But I know that they're promising to make sure that aligned school districts receive, and the larger school districts receive first dibs at the first set that is being distributed. So that's one thing we know of. Not only laptops, but about 185,000 scholastic materials, K-8, will also be donated. And again, aligned school districts are at the top of that. We have about 33 aligned school districts. But they're making sure they're servicing school districts that really do not have much, and there's an equity issue right now. I don't know, what was the other part of your question, Thomas?
The other part was for students who don't have reliable internet access at home. Is there anything included in the Partnership for Connecticut's donation that will allow for internet access?
No, so that was part of the discussion this morning that school districts, urban school districts are having a challenge with right now with the lack of Wi-Fi and hotspots for our families. And yeah, it's great to have the laptops, but if they do not have the ability to access these internet services or have a hotspot in their area, it's going to be difficult. On our side, we have been talking about probably the utilization of our buses to deliver hotspots for families. But then some school system this morning reported that it was not really worth the while to do that. They gave a lot of information as to why they have tried it and it didn't work well for them in their areas. So a lot of discussions are still continuing. I know that something came up with our elders, I think, Mayor, about looking into areas, in particular, some of our areas that are needy areas, about getting internet access. But it's going to take a while. It's not something that can happen like right away. I know that we have been in communication with Comcast, but then I'm finding out that there are also restrictions. Even though they're offering free, there are also restrictions. And so that's one of the challenges we have in New Haven public schools. The lack of devices and also the whole equity issue for our families.
Thank you very much, Superintendent. And I have a few other questions, Mayor, but I'm happy to defer for a bit to others.
Okay, thanks. So I saw Mackenzie raise her hand. Go ahead, Mackenzie.
Thanks for taking my questions. I had a few questions about the memo that your office released yesterday about the career shelter. First, it looks like the capacity is now 50 beds, and I'm wondering what triggered the change from the original planned capacity of 75. And then it also looks like, based on this memo, that there is a full staffing and security plan in place. And so I'm wondering what the numbers look like on the staffing and if that includes any newly trained Medical Reserve Corps volunteers.
So the capacity issue, our staff reviewed the site and felt like 50 was more manageable of a number of people. So that's why overall we reduced the number, the capacity, or the number of people that would be on site. And as far as staffing goes, we'll have several police officers on site. We will have several medical reserve corps individuals that will be nurses or other medically trained individuals that will be inside monitoring. And we also have off-site on-call doctors 24/7 in case there's issues that come up that the Medical Reserve Corps volunteers need to reach out to the doctors to rely on their advice. We have cameras inside the facility as well to monitor if there's any issues that come up.
And does that Medical Reserve Corps group include any new trainees beyond the initial 19 and then an additional 6 that came a few days later?
Director Bond, do you know the answer to that?
No, it was the 19 and the 6 that were trained, and there haven't been any more.
All right, and then just one last question, sorry. It seems like the site is ready to open, but is not yet required, and it looks like maybe we're going through a screening process. Could you just talk a little bit about what the timeline looks like for the next few days?
So,
Sure,
yeah.
so go ahead, Director Bond.
So we're actively just working closely with our health system and awaiting to have eligible individuals to admit into the process. And so once that occurs, we will activate our shelter formally, but everyone's on standby and ready to go.
All right, that's all from me for right now. Thanks so much.
Thank you. Before we go back to Mr. Breen, anybody else have questions here? I see Kyle.
Hey guys,
Hey.
Question for the Worcester Square cherry blossoms. I know that you just mentioned the holidays this week, and I know the festival has canceled, but we were working on a story about that. What's your guidance for that as far as making sure people are still social distancing if they want to get out and take a walk and take a look?
Yeah, I think it's consistent with the guidance we've been giving for quite some time. We don't want to impede people from walking outside. If people cannot stay 6 feet away from other people, they should not be going to a site. And I think people can use their judgment and be cautious and decide that they can go back at another time of day if that's not appropriate. We're also strongly recommending that people wear face masks when they go out in public to reduce their likelihood of spreading the virus themselves. As it's become quite clear, people that are asymptomatic can oftentimes spread the virus and they may not even know that they have it yet. And so we're encouraging everyone in the community to wear masks when they go outside. And this is just that type of scenario where that would be appropriate.
Okay, I think that's all for me right now. Thank you.
You're welcome. Mr. Bingham, did you have a question? You're good?
I'm good, thank you.
Okay. All right, let's go back to Tom.
Thank you. Do you have an update on how many police officers or firefighters have moved into UNH's campus as part of the city UNH agreement?
I don't have an exact number. I can get that for you, but I don't have a number.
Have more people moved in since you last updated us?
I think
over the
we're
weekend?
probably around the just below 10 mark, but I can check.
Thank you.
Yeah.
And then my last question is, any updates you or Director Bond have about how city grocery stores are complying with the governor's social distancing and safe retail orders?
Director Bond?
Just unmuting. So in regards to the grocery store question on compliance, we have begun to conduct inspections, and as of my report of yesterday, we had everyone in compliance and everyone activated the shields and mechanisms to mark the areas that are needed. And so we're very pleased with the reporting that I received yesterday from our inspectors that went out.
Very good. Thank you very much. That's it for me.
I'm going to unmute Mary O'Leary just in case. Trying to unmute Mary.
Can you hear me?
Mary, yeah, yes, I can. Do you have any questions?
Yeah, I do. Sorry, I don't know why it
Thought
does
so.
that. The number of homeless that you're going to be moving into hotels, could you give that figure again? Is it, I thought you said 800.
So across the state.
Across the state, okay.
Yes.
How many in New Haven?
I can confirm that number in New Haven. I know our goal or our request from the state was 300 about a week ago, total. But I will. I can confirm that number.
All right.
And it's important. It's also important to note that these are not just people that state that their residence is New Haven. There are many people that stay in New Haven homeless shelters that report their residents from other towns, including towns like West Haven. So we're trying to support a regional approach to addressing this problem and have people from a variety of different locations that are staying on New Haven, the city of New Haven's dime when it comes to food. We're paying for food for people in the hotels and are staying in New Haven hotels, and we're hoping other hotels in the region. But these are not only people that say that they are from New Haven. There are people from all around the region.
So are you going to get any reimbursement from other towns for the food?
That is not our expectation, no.
All right.
Our expectation is we will get some of the food costs reimbursed by the federal government because of the emergency. My understanding is that the federal government reimburses 75% of a lot of the costs that are specific to this emergency. And so that's what our intention will be, is to get reimbursed through that.
All right. As far as the Best Western, my understanding now is that 96 rooms are the contract, which...
You have better information than I. I don't have the most recent information.
All right. Is it La Quinta and the Village Suites? Is that the other two? I mean, that's what I was told originally. Are they still serving?
So that may be what you've been told. We've had a policy not to state the hotels. I think the Best Westerns come out so much in the press, which is why we're acknowledging that that's one of the ones that's on the table. But we have not been putting out the names of the hotels because we don't want a lot of people showing up at the hotels without going through the process to secure rooms.
All right. And do you know what the rules will be in the hotels? I mean, it's not quite a quarantine, but is it close to a quarantine? I mean, people are...
It's expected that people stay in their rooms. There's going to be staffing on site from the different homeless shelter providers. And people, the whole purpose of this is to allow people to, similar to others who have the ability to practice distancing at home, allow people in this setting to practice social distancing. And so people should not be congregating at the hotels. They should be staying in their rooms, and that's the expectation.
All right. I mean, do they leave for certain reasons, medical work? And is it just that? I mean, they basically aren't free to take a bus and go someplace.
People are free to do what they choose to do. The purpose is similar to when they're at a homeless shelter or wherever else, and similar to you and I. We are encouraging, just like I encourage everyone in this call and everyone listening, to stay at home as much as possible, to only take essential trips. And that's the same directions that we're giving to the individuals that are staying in these hotels.
Okay. So who's going to prepare the food, or who are you contracting for that, I guess?
We're working through that process. My understanding is that we're working through that process. I can get you a more specific answer of what's going on now and how we're going to be ensuring that people get food moving forward.
Right. I mean, and I know Columbus House put out its own release describing, their situation, and they've moved everybody out. I assume that they had moved into the other shelters or the other hotels. Now I'm being told that they're going to Best Western. I don't know if you know anything about that.
So my understanding is people that were at Columbus House moved into the New Haven hotels several days ago or whenever we first announced this.
Okay. Just maybe on the career, when you're describing the personnel that we're going to take care of people, besides the medical reserve people, are there, and maybe they are the people, but are they medical professionals as opposed to the volunteers? Are they trained nurses or residents at the hospital?
Yeah, all of the medical reserve corps individuals are healthcare professionals with a variety of different license and skills. And there will also be a medical director on call at all times as a city staff that will be available.
And keep in mind, these are the individuals that will be at the site are COVID positive, but they're not sick enough to be at the hospital.
Right.
It's important to have people there to support in case there's something that comes up. But in general, they won't need intensive medical care.
Okay.
If they do, they would be transported to the hospital.
Right. I think I asked you this before, but how many people in that situation are kind of in the pipeline to be transferred to career? Is it?
I don't think we can give you an answer to that because we don't know. We're starting to see the spike now, and we feel very fortunate that we're prepared to provide housing to people or to provide a site for people to self-isolate that we did not have a week ago.
All right. Any thing on a contract with Yale? My understanding is that they've taken in another person who's positive.
So our lawyers and Yale's lawyers are talking now.
All right.
We know how that goes, being married to a lawyer.
But I mean, if that's my understanding now is that's the second person, so it sounds hopeful. I mean, that's a huge get, I guess. If there's a place for people who are sick, who can't go home and need to be sheltered, it seemed like the hardest place to actually find are people to agree to do that.
So you're right. That is something that is more of a commitment. We're seeing that as a possibility at Southern for healthcare workers, and Southern's taking people on their campus that are COVID positive. Yale's also agreed to, through the Landman Center, take people that are COVID positive. We're having conversations with other entities in the city as well.
All right, I'll just confirm this, but two first responders, my understanding is that are at Yale. One's from New Haven. One is a different town.
What I can tell you is the first responder which is a firefighter that was at Yale is no longer there, and that has nothing to do with the university. The person needed to be transferred elsewhere, and the person is doing okay.
Okay, all right. So people on the Yale campus, I mean, I understand you're negotiating this, but if they already have a place, I mean, they have Lanham, where they're going to put people that are not sick enough to be in the hospital, but to need some care in place.
Correct. My understanding is that there's no one yet at Lanham. Landman Center.
All right, so maybe you'll know by the end of the day from the state how it went on its negotiations, I guess, right? That's what.
I think I will comfortably say that I will know that when people are actually in the hotel rooms.
So the 300, that's, if this comes through, that will do it for New Haven? I mean, that will solve New Haven's problem as far as.
That was our goal. But the situation around individuals experiencing homelessness is always changing. And we do have a concern, given that there is some decompression of the state prisons, which is, in my opinion, a good thing, that there may be an increase in individuals experiencing homelessness in New Haven. I have a concern that, given the pressures economically on people, that there may be an increase on individuals experiencing homelessness in New Haven. So we're monitoring the situation now, and anticipating, as always, that this situation might change.
Okay. Maybe this is too soon for planning, but once this passes and people who are homeless do have a place to stay right now, suddenly they won't when the whole thing is over. What's going on as far as, housing, I guess? Is someone planning that?
So I think you're right that it is early, but I think all of us are starting to think about the new reality, I guess, is the way to frame it, because this is not likely to be, quote unquote, over for a very long time. What it is likely to be is managed. And in 3, 4, 5 months, we will need to manage this situation. And so I think that one of the tests that we will all face is how well we as a country, as a state, as a city manage the crisis and quickly respond to an additional outbreak. How quickly we will be able to improve our ability to test, to contact trace, to stamp out any new spread is something that will help us respond in the future. And so, to your particular question around homelessness, we don't yet have a well thought out plan of how we can make sure that individuals experiencing homelessness continue to have an ability to reduce their likelihood of getting the virus, because inherently, a lot of the scenarios where homeless people are in, they are congregate living and they're interacting closely with other people and don't have a lot of options to self-isolate. So this is a roundabout way of saying that we don't yet have a good plan, but it's something that we will be working on as we move forward to manage the new state of living.
Okay. So I assume the state is on board with you. I mean, if they're letting people that were in prisons out, they go back to the homes where they came from, which increases the potential for more homeless people.
Well, so that's a developing situation right now, and we need to talk with the state about how to manage this well. And I don't have a sense of the numbers at the moment, but it's something that we're very aware of because we don't want it to become an additional challenge. While it's good that the state is decompressing the prisons, similar to what we have worked to do in our lockup in a facility in New Haven, we want to make sure that we don't create an unintended consequence.
Okay. And again, you're negotiating with Yale. Nobody's in Lanham right now. So how they would take care of individuals, if that is what they end up doing, it's not clear where they would stay, actually, I guess.
So we're talking about rooms and not Lanham Center.
Okay.
Lanham Center has been discussed by the university as a place for university staff, professors, students who test COVID positive but are not sick enough to be in the hospital to go for some care. And separately, the university has or is working on clearing 300 rooms for the potential for other individuals to self-isolate. In our conversations, and our lawyers are talking about the 300 rooms.
Oh, so it's self-isolating. It's not people who are sick and need a place to stay.
Well, so it's the lawyers are talking, but my hope is that this is a place where people can self-isolate if they are sick, if they are symptomatic, if they're COVID positive, or if they are symptomatic.
Okay, which they've already done once, and my understanding now is twice. I mean, there's another individual.
Correct.
Okay.
I can confirm R1. I can't confirm. I've heard about this other person, but I can't confirm that person.
Okay. And I don't know if you did at the beginning of the call of how many firefighters or police are in limbo, waiting for test results.
We have 4 positive police officers, 7 positive firefighters. There's 34 police officers that are currently out. And there's, I believe, 6 firefighters in addition to the 7 that are out. So 13 firefighters that are out.
So that's 6 more that not necessarily COVID. I mean, they're out, not working, or they're out
They're awaiting results.
getting results. Okay. I'm sorry.
Mary, a lot of questions.
I know, sorry. Just one more, at the beginning of the call, did you have the number, the updated, and how many people are
Yeah,
sick?
but you missed it.
I know, sorry.
That's okay. 361 COVID positive cases in New Haven and 12 fatalities.
Any description on the fatalities? Where they go? I mean, how many, what's the age?
Director Bond?
Yeah, sure. So we have 12 untimely deaths, and the youngest age is 42, and the oldest in 93.
Nobody's died from Bella Vista, is that correct? None of the deceased are from Bella Vista, is that correct?
So Mary, as I disclose every single time, I do not disclose the locations of individuals' untimely deaths. I will disclose some general demographics.
All right, thank you. Thanks.
You're
Any other
welcome.
questions? Going once, going twice. Thanks so much, everyone. Appreciate the time. Talk to you soon.